Vitamin D is considered one of the essential nutrients that plays a pivotal role in maintaining overall health, as it helps with the absorption of calcium and phosphorus, which are necessary for strengthening bones and teeth. It is known as the sunshine vitamin because it is produced in the skin when exposed to ultraviolet rays from sunlight. Vitamin D deficiency can manifest in various ways. Some common signs and symptoms include bone and muscle pain. Persistent bone pain or muscle weakness can indicate low vitamin D levels. Frequent fractures, weak bones that are prone to fractures or osteoporosis. Fatigue and weakness, general tiredness or feeling of fatigue that isn't relieved by rest. Mood changes, increased risk of depression, anxiety, or mood swings. Hair loss. In some cases, significant hair loss has been linked to vitamin D deficiency. Delayed wound healing, slower recovery from injuries and wounds may also be a sign. Vitamin D levels are typically measured by a blood test that determines the concentration of 25-hydroxyvitamin D. While reference ranges can vary slightly between laboratories, general guidelines include deficiency less than 20 nanograms per milliliter, 50 nanomoles per liter. Insufficiency 21 to 29 nanograms per milliliter, 52 to 72 nanomoles per liter. Sufficiency 30 to 100 nanograms per milliliter, 75 to 250 nanomoles per liter. Potential toxicity above 100 nanograms per milliliter, 250 nanomoles per liter. Recommended daily intake. For most adults up to 70 years old, the recommended daily allowance, RDA, is about 600 IU 15 micrograms of vitamin D. Adults over 70 are generally recommended to have about 800 IU 20 micrograms daily to help maintain bone health. And for postmenopausal women who are at an increased risk for osteoporosis and vitamin D deficiency due to hormonal changes that affect bone density. Many healthcare providers recommend they meet their vitamin D needs, often through a combination of sunlight exposure, diet, and supplementation. Sources of vitamin D can be obtained through moderate exposure to sunlight, which is considered the most effective natural source for its production. Additionally, there are dietary sources rich in vitamin D, including fatty fish such as salmon and tuna, cod liver oil, certain types of mushrooms, fortified foods such as some types of milk and breakfast cereals. Furthermore, doctors may recommend taking vitamin D supplements in cases of deficiency or when it is difficult to obtain an adequate amount from sunlight or food. The role of vitamin D is not limited to bone health alone. It also includes supporting the immune system. It helps in fighting infections and enhancing the body's natural defenses. Preventing chronic diseases. Research suggests that maintaining sufficient levels of vitamin D may contribute to reducing the risk of some chronic diseases, such as heart disease and certain types of cancer. Improving mood. A deficiency in vitamin D has been linked to increased rates of depression and anxiety, while maintaining normal levels can help improve mental well-being. When it is needed? Limited sun exposure. If you have limited exposure to sunlight due to geographical location, lifestyle, or skin coverage, supplementation may be necessary. Risk of deficiency. Individuals at higher risk of vitamin D deficiency, such as those with darker skin, older adults, people with obesity, or those with certain medical conditions, may benefit from daily supplementation. Existing deficiency. In cases where a blood test confirms vitamin D deficiency, healthcare providers might recommend higher doses temporarily to restore adequate levels before transitioning to a maintenance dose. Certain health conditions either result from vitamin D deficiency or benefit from ensuring adequate vitamin D levels, like osteoporosis and osteomalacia. Low vitamin D levels can lead to weakened bones, making conditions like osteoporosis, common in older adults and postmenopausal women, and osteomalacia, softening of the bones in adults, more likely. Rickets. In children, a severe deficiency can cause rickets, a condition characterized by impaired bone development and skeletal deformities. Hypocalcemia. Low vitamin D contributes to low calcium levels in the blood, which can affect muscle function and nerve signaling. Immune-related conditions. Adequate vitamin D levels are important for immune function. Some autoimmune conditions, such as multiple sclerosis, rheumatoid arthritis, and certain inflammatory conditions, have been linked with low vitamin D levels, though research is ongoing. Chronic diseases. Emerging evidence suggests that maintaining sufficient vitamin D may help reduce the risk of chronic conditions such as cardiovascular diseases and certain types of cancers, although further research is needed to fully establish these links.